Hypertension. In our previous video, I did highlight how hypertension was thought to be rare in Africa, but now it is considered as one of the most causes of cerebrovascular diseases and contributes up to 40% of diseases in this continent. In this video, we are going to talk about how pressure in the heart is generated, what is normal blood pressure, and what is high blood pressure. So let us dive into it right now. Hi, I'm Dr. Mura, a certified lifestyle medicine physician and co-founder of Dr. Mura Health. Dr. Mura Health equips you with lifestyle changes on how to prevent, treat, and even reverse chronic diseases. When we talk about hypertension, we refer to high blood pressure in systemic circulation. And this is because hypertension can also occur in the pulmonary circulation, the topic of another day. Truly speaking, systemic hypertension occurs in arterial wall, in arteries. And that's why when you talk about hypertension, we refer to systemic arterial hypertension. Now, how is blood pressure generated? Can you feel your heartbeat? You can easily feel your heartbeat right here, or you can even check it here. Can you feel that? Now, that heartbeat that you're feeling, it's a symbol of the action that is happening in your left side of your heart, left ventricle to be specific. So there is left ventricles contracts and pumps the blood to the rest of your body. Now, during each left ventricular contraction, the highest sustained systemic pressure is what is referred to as systolic. Right. By the way, your heart beats at average of 100,000 times per day and does not stop. Of course, until it does stop, because, well, we cannot live forever. But that should happen probably in your 90s or when you're 100, and it shouldn't happen because of high blood pressure. Anyway, after the left ventricular contraction finishes, then the left ventricle relaxes and refills again, and the systemic pressure in the arteries drops. And it is during this phase we have the lowest systemic pressure is considered to be, or referred to as, diastolic. So blood pressure specifically has just two numbers, it's a systolic and diastolic. Having said that, it's a range, it varies. There are many factors that can affect the blood pressure. Talking about the age, gender, body weight, physical activity, what you eat, what you drink. Because there are variations, the blood pressure is not a constant and it can vary from one person to the person. But having said that, from medical point of view, medical perspective, there had to be arbitrary cutoff of a certain number. And the scientists studying this, they realized that at above certain number of blood pressure, the more the blood pressure goes up, it is associated with some complications such as cardiovascular diseases and stroke. So what is normal blood pressure? The normal blood pressure is considered as systolic blood pressure less than 120 millimeters of mercury and diastolic blood pressure less than 80 millimeters of mercury. What is high blood pressure? High blood pressure has been considered for a while as blood pressure equal or more than 140 millimeters mercury systolic, or equal or more 90 millimeters mercury diastolic. Having said that, in 2017, the new guidelines from American Heart Association and American College of Cardiology, plus 9 other health institutions, they dropped what is considered as high blood pressure from 140 over 90 to 130 over 80. Important to notice, mention that Southern Africa Hypertension Society has not changed that. Still considers high blood pressure is 140 over 90 millimeter mercury. But from what we discussed previously in our last video, we noticed that any blood pressure above 110 over 70 has been associated with a complication like heart attacks and stroke. So it is always better to have that blood pressure on the lower side than to let it get elevated. Next, we talk more about hypertension, what causes hypertension, and how can you really be able to check your blood pressure at home.